Hi guys, welcome back to my channel. My name is Sonia Ogon and I'm a medical doctor. I work and I live in Abuja, Nigeria. Welcome to today's video. So I'm trying my best to upload one video every week and I'm trying to make it to be on Wednesdays. Okay guys, so as you can see from the title, today we're going to do a little bit of learning. Today we're going to do a little bit of sensitization, and I feel like this video will benefit a lot of people and especially Nigerians, okay, because I feel like there's this confusion. So let's try to clear out some things. Is that okay? So as you can see from the topic, today we're going to be talking about malaria versus typhoid. Okay, it's a very common complaint that we hear in the consulting room, which is why I decided to bring this up and let's have a little chit chat about it. Most times we get complaints from patients that the first thing they say is, "Doctor, I have malaria, typhoid." Now there's this belief that I think Nigerians believe that malaria and typhoid, they work hand in hand together. That is not true. Okay, so let's try to differentiate them so that you can actually know which is which. Now, malaria is caused by a parasite, which is the mosquito Anopheles, the female mosquito, and it causes the different types of malaria. We have the falciparum, we have the vivax, we have the ovale, we have malaria, but mostly the one that is more rampant or conversant in this our region is Plasmodium falciparum. Okay, so that's the most common one. And then typhoid is actually caused by Salmonella typhi. They're actually grouped in a family of, we call them enteric fevers, which is like fevers that's caused from the gut, from the stomach, basically. The mode of transmission for malaria is through insect bites. When this parasite bites you, that's how you get malaria. Okay, now the mode of transmission for typhoid fever is fecal oral. What does fecal oral mean? When you wipe your bum, you don't wash your hands properly and you put it in your mouth. Okay, dirty water, dirty food, that's how you get it. So it has to come from the gut and then to the mouth. Meanwhile, malaria is through bite. You see, they are two different things. Number one is caused by parasite. The other one is caused by a bacteria. One route is through insect bites, and the other one is through wiping, putting in your mouth, not washing your vegetables and all of that. So most times when people just have certain symptoms like, oh, my body is paining me, or I'm having a headache or whatever, they go to the pharmacy, they buy anti-malaria and they buy antibiotics because they have malaria and typhoid. No, I can assure you that you do not have typhoid. I can assure you that you don't have typhoid. Okay, so let's talk about the symptoms. I feel like this is where this video will be very, very important. Malaria comes with a fever that is intermittent, right? It's like cyclic, sort of. It comes in the morning, goes in the afternoon, comes back in the evening again. That kind of a fever. That's why people that have malaria, most times the fever gets very high at night and in the morning, but during the day they are sweating. So when I'm seeing parents and I'm suspecting that this could be malaria, I tell them that there's a chance that this fever is going to come back at night again. Should it happen, don't worry. Continue with the medication, expose the child, tepid sponge the child, and the child will feel better. Just so that in case they get home and the child is still having starts having fever at night, it won't be as if the medication is not working. That's how malaria pattern of fever is. It's just intermittent, morning and then in the evening. Okay. Now malaria too, it comes with cold, chills, and then rigors. Rigors is shivering. Okay, it comes with that. There's also nausea when you feel like vomiting, and then there's vomiting too. There's reduced appetite. Okay, in very severe cases, we see anemia, which is low blood. The person's blood will start getting low. There's actually what we call cerebral malaria. There is jaundice, yellowness of the skin when the liver gets infected, but those are very, very severe cases. Okay, but basically high fever that is intermittent, chills with rigors, that's cold with shivering, feeling like vomiting or even vomiting, to reduced appetite, malaise. Those are the symptoms of malaria. Also body aches, muscle pain, those are the symptoms of malaria. Now let us enter the symptoms of typhoid. typhoid comes with a sustainable fever, which is the fever. Let's say, for instance, you started with a fever of 37.8, it goes to 38, 38.8, 38.7, then 39, 40. So it grows. The fever just keeps, it doesn't get better. It just continues getting higher and higher, and the fever is always high grade, so to say, even higher than malaria kind of fever. Salmonella typhi, that's enteric fevers. It comes with a severe guarding abdominal pain. Like, what I mean by guarding is like the kind of abdominal pain that you would have to put your hands in your tummy to hold it, and there can be constipation or diarrhea. There will be vomiting. Okay, there'll also be malaise. Okay, that's you'll be feeling really weak. In some severe cases of typhoid, it could actually lead to perforation, which is your guts, your intestines could actually burst open, and in cases like that, we take you to theater and we have to resect the affected part of the gut. So typhoid is actually very severe. It's actually very severe. So it's not something that you just say that you have typhoid, because I can assure you that if you actually do have typhoid, you will not be able to even walk to the hospital. You will be very down. You get, so it is that severe. So it could also be that, yes, maybe you do have a bacterial infection, but it's not necessarily that it is typhoid that you have. Let's say we do a full blood count and we notice that your WBC is high or your neutrophils are high, which is actually an indication that there is an ongoing bacterial infection inside. Fine, we're going to treat you with some broad spectrum antibiotics. If you need to be admitted, we'll admit you. But the thing there is that it doesn't mean that you're having typhoid. So how do we test for malaria and this and the salmonella, this typhoid, right? So for malaria, we have what we call the rapid diagnostic test, where they take your blood, they check if it is there, if malaria is there or it's not there. Okay, then we have what we call the thin and thick film test. So that one will be able to tell us you have 1+, you have 2+, you have 3+ is malaria. Then for salmonella typhi, that's typhoid, most laboratories, they use Widal test, but Widal test these days is actually not specific. It can be sensitive, but it's not specific. So we don't, like the hospital that I work in, we don't use Widal test because it's not specific. Okay, because for you to use a Widal test, it has to be like you do the test today, you see the titer that it gives you today, you see that you do another one tomorrow, you see the one it gives you tomorrow, you do the one next tomorrow, and it has to be increasing. The figures have to be increasing in order for you to know that yes, this is actually something is going on in the gut. Because if I should do the sample now, it might show me something. That doesn't mean I have any symptoms. I mean, there are bacteria in my tummy. You get, but is it really manifesting? Is it really doing anything? So what we actually use is the stool culture. We take your stool, we culture it in the lab, and we look for Salmonella typhi. If Salmonella typhi is present in the stool, then based on the sensitivity, which is like the specific antibiotics that we should use for it, and then we treat. You get, so the specific test is actually a stool culture to test for Salmonella. All right. So now for the management of either malaria, we use anti-malarials. We have the injectables, we have the tablet form, different combination of tablet forms, and then for the typhoid fevers, we use antibiotics to treat. Depending on the sensitivity, when you culture the stool, it will let you know which antibiotics is more sensitive, but most times we use fluoroquinolones. For supportive management, we always give like antipyretics, something to bring to reduce the fever. If you're vomiting, we can give you some antiemetics, place you on fluids, a lot of fluids, okay? Just basically support yourself while you're down, treat the symptoms that you're having. while the main medications takes care of the problem. So this video I made right now is because I see a lot of these cases, and I try my best to counsel a whole lot of people that enter my consulting room that malaria, because you have malaria does not mean that you have typhoid. It could just be malaria alone. So that because the rampant usage of antibiotics these days is actually getting out of hand, there is this huge abuse and everybody keeps taking it. When you actually need these antibiotics, they tend not to work anymore because you have abused it. Okay, sometimes I might do a full blood count for myself and I can see that my neutrophils are high, which means that there's an ongoing bacterial infection going on, but I won't take any antibiotics. Like, it's not really that a lot, and I have natural killers, so I'm not doing any medications. I would advise that if you have any symptoms, go to the hospital and get properly diagnosed by a physician, medical doctor, and someone that actually knows what you're doing. And second of all, there's a whole other things that always get confused or that are being mistook for malaria. The weather right now is not very favorable. Like flu-like symptoms like catarrh, cough, sore throats, they get mistaken a lot for malaria, but they're actually not malaria. Okay, it will actually weigh you down. You would feel sick. It gives you a gritty sensation in your throat. There's fever. Sometimes it could be a low-grade fever. Sometimes it could be a high-grade fever. There's sneezing, and then there's coughing, there's stuffy nose. Those are all flu. Okay, they are just they're cold, common cold, and it can actually make you feel like you are sick. You will feel sick. You would be down. You would be having the whole myalgia, muscle pains, joints ache, and everything. But it's not malaria, I can assure you. And there's no really treatment for that. You can only treat the symptoms. So when you go to the hospital and you tell them your symptoms, they'll be able to manage you appropriately. After like 4 days, 4 or 5 days, you should start feeling better by just taking as little as paracetamol, taking a lot of fluids, okay, taking vitamins to boost your immune system, and you'll be good. So again, the reason why I'm saying this is because there's a whole lot of abuse out there with medications. Most people are already having resistance to anti-malaria and antibiotics because like the usage. There are people that take anti-malaria like every single month, and it's really crazy. So I hope that this video is able to help somebody out there to be able to know that malaria and typhoid, they don't work together. They have two different causative agents, two different modes of transmission. Everything is just different. Even their treatment is different. So not every time you start feeling feverish and your body is paining you, it means you have typhoid. No, it doesn't mean you have typhoid. Okay, so please go to the hospital and get properly diagnosed, and so that you can be treated properly. Thanks for watching, and I hope this video was a little bit educative for somebody out there. Bye, and see you on my next one.